Well, good morning, class, and obviously a good night for me. So for today's topic, I'm going to be talking about sleeping deprivation's impact on older adults' health. Now, for the importance of sleep, sleep deprivation is something that could never go unmentioned, and sleep deprivation is where somebody loses hours of sleep during the week or quite possibly the weekend, and it comes with the false notion that some people do believe that they can catch up on their hours of sleep on the weekend that they missed during the weekday. And unfortunately, that premise is false. And, I'm not going to say that I did not fall victim to it. I do have a clip here to show you all of something that did keep me up quite a bit as I was a child. And, hopefully it'll be a little bit for everybody to remember.
This is Boomerang from Cartoon Network.
So, if you guys are not familiar with that is Boomerang. Great TV network. But anyways, so the importance of sleep. So sleep has major restorative functions in the body that include muscle growth, tissue repair, protein synthesis, and growth hormone release. But negative sleep changes are associated with worse cognitive functioning. So it is, again, very important to sleep the recommended amount, 7 to 9 hours a day. And that is for adults aged from 18 all the way up until they pass away. So on to older adults. So for impairments from lack of sleep for older adults, there is an increased development of chronic diseases, mainly cardiovascular or type 2 diabetes. Sleeping disorders do arise from this as well as sleep apnea, resting leg syndrome, and also dementia does come through as well in sleep deprivation. Another thing is noticeable detriment to attention span. So I have Bernie Sanders down there for you. An increased sleep fragmentation does increase the risk of falls in older women, and that was done in a study in 2017. And elderly participants also with persistent insomnia, so they have, unfortunately, the ability of keeping themselves up throughout the entire night without sleeping. People who do suffer from insomnia like that have reported to have an increased risk of depression, and that is, again, something that we do not need to be going through in such a severe time as this with COVID-19. So some other impairments, though, that I did not mention earlier as a result of sleep deprivation do include a decreased reaction time and accuracy, hallucinations through the day and the night quite possibly, and an impaired immune system, which at this moment in time, you do need to be staying strong with it through exercise, through eating healthy, and again, through the recommended amount of sleep that's needed throughout the day. So what could be done to address sleep deprivation, not just in older adults, but for everyday people? Well, ways to improve your sleep hygiene do include identifying what the issue can be. So quite possibly, if you're an older adult, you do have medication prescribed to you for possibly other pains that you have going on throughout your body, maybe any other chronic illnesses that you have to deal with, other disorders. Well, the main thing is identifying if those do have a side effect through your doctor, and being able to go through and see that the risks that this could bring to your sleeping pattern. Now, another thing too is eye strain. I know a lot of everyday people are looking down at their phones, their computer screens for work, their TVs for entertainment, and it's getting a bit much for eye strain, and it does take down about 30 minutes of your sleeping time before you're about to go to sleep due to that eye strain. Now, another thing could be also due to lack of exercise. Not getting the body regulated enough through exercise is something that can really deprave your sleep and keep you up. Stress, another big thing too. I know this kind of time right now is super stressful. People losing their jobs, people losing their family members, people really going through a lot. So any way to where you can de-level your stress is important. Evaluate your sleeping environment as well. You might be in a very uncomfortable environment to where, there's loud noises around all the time. Bed's not comfortable enough. You have, other stimulants in your area that can be tempting, like caffeine with coffee at night. Not a good mix as well. But again, the most important thing to improve your sleep hygiene is definitely exercise. And exercise has been known to be important because exercise has been proven, even in a current study that was done just in 2018 by Dolezal. It was a meta-analysis of 29 different studies that were done to measure exercise and its impact on sleep, and all of them came significantly through that people who engaged in even just leisurely physical activities such as walking every day a couple miles, using the bus, public transportation, those people did have improved sleep. So it is very important to have a physically engaging lifestyle to aid your sleep. And lastly, I want to thank all of you guys for watching, and especially you, Dr. Thompson, because I just want you to remember that for sleep, if there was no sleep, this might be you walking into class on Monday and Kilmarnovitz.
Julian.
Thank you guys.